This is the Bartholomew Town Podcast.
Well, there's no question that COVID-19 has been the dominant story, not only in the world of healthcare, but also in general, right, over the last 20 or so months. And it continues to be a headline grabber, although we're trending towards a point where other major conversations are, in some cases anyway, usurping COVID as the talk of the day. There's no question about that. In particular, here in Rhode Island, there are a number of stories in the healthcare world that are important to examine and understand as a part of our broader news cycle. And today on the pod, we are joined by Convergence Rhode Island's Richard Asinof to break all of those down and give us sort of a summary of, if you will, the year in healthcare news and the industry surrounding healthcare. So as always, thanks so much for joining us. Remember to follow me on Twitter and Instagram at Bill Bartholomew. I'm also on TikTok now. Look out and join the Bartholomew Town Podcast Facebook group. For as little as $3 per month, you may become a B-Town insider and help to sustain this program. Simply click the support link wherever you're listening right now or head to patreon.com/BartholomewTown. Another opportunity to check in with Convergence Rhode Island's Richard Asinof here on Bartholomew Town. And look, there's plenty going on, plenty to talk about. And it's almost like, where do we start? It's been such a crazy year. People will think of 2020 as the crazy year in terms of healthcare and so on and so forth. But so much has happened in this year. I guess to you, as you evaluate and assess some of the big stories that you've broken or covered in your reporting or interview with the governor, right now, what's the most essential issue for Rhode Islanders to know about and to understand in terms of healthcare and the industry surrounding it?
I think the most important thing is for people to understand the power they have to change what is going on. I think the stories that have been most fascinating to me are when things like the recovery community bands together and rebels and wins a victory against a very entrenched bureaucracy at Buddha and gets cuts rescinded of more than $2 million. That's a story that never happens. A second story is what happened when, the chief medical officer, Dr. Andrew Saul, stopped a variance for Narragansett Improvement Company with his testimony. We always hear about, a small band of citizens coming together and they can achieve everything. Well, that's rarely the case in my experience. And he gave incredibly damning testimony about what was going on because his community health center facilities were less than 250 yards from where asphalt was being ground up. And he described how there was a leakage, if that's the right word, and all the cars in the parking lot for the employees and patients were coated with a tarry substance, and Narragansett Improvement Company had to send over power washers to clean everything up. And at the end of his testimony, he asked, because his co-workers asked, how do you clean that out of your lungs? And the answer is, you can't. And what we see is that people are understanding that they have a power that's very different than the entrenched bureaucracy, which is what I will call it. It doesn't mean that people don't have good intentions and they're trying to really improve conditions, but it's really a time, I think, when we have to understand that there is no cavalry coming. There is nobody who's going to save us from our predicament but ourselves, and we have to depend on ourselves, particularly when it comes to healthcare, to make a difference.
That is such a fascinating take, and it's so true. And even when we look back on COVID-19, I think that between the activists and the Equity Council that was formed, in some cases, journalists and the general public as a whole, things were able to be shifted in a more productive direction. I think with conversations around access to testing, transportation, translation, things like that. And that was all people power. That wasn't something that the Raimondo administration or Boston Consulting or whoever they were had on, at least it didn't seem like that was on the forefront of their agenda when it came to the COVID response, the initial response.
Well, if you look at cases like Dr. Beata Nelkin, who set up her own practice. She hung up her shingle right on the main street of Central Falls, on Broad Street in Central Falls, taking a risk. And it just happened to coincide with the COVID-19 pandemic. And she, became the lifesaver for the community because she was able to provide testing. And then when the vaccines were the available vaccines, and also provide care for children who may or may not have had insurance. And so she became the go-to place in the community. She got handed the key to the city of Central Falls by Mayor Rivera to celebrate International Women's Day. And she's going to be honored this week as one of the Rhode Island Public Health Association heroes.
Yeah.
And she's not doing it for fame or notoriety, but she's a great example of one person really can make a difference and really empower the people around her in her community to get the health care that they need. And that's a story that we could spend a lot of time talking about, but, it required her to get the rapid testing kit from the Department of Health, which actually, if it came probably from the Commerce Rhode Island, which had a bigger role than most people realize in decision making. And, these things make a big difference in people's lives. You can also look at the stories of One Neighborhood Builders, and they set up their own free Wi-Fi system to serve the residents of Olneyville, using the buildings that they owned to set up a wire mesh system, because the number one worry from a survey of their residents was that it was difficult for them to connect to the internet for all the things that people depended on during the pandemic, whether it be healthcare and access to a physician, or checking up on tests, or school that was being done virtually. All those things revolved around having access. And that wasn't something that was possible. And they currently they did a survey, I think they're currently serving more than 1,000 families or households in Olneyville, which makes a big difference in people's lives. That's a story that doesn't get covered enough. And imagine if that was scaled up for all of Rhode Island, where you could have a free wire mesh network for people who wouldn't have access to the internet otherwise.
Right. It's the kind of thing that, again, like you say, it doesn't get covered anywhere near enough. It's your beat. It's what you deliver, but it doesn't sell, I guess, mattress ads the same way that a fire down the street in Pawtucket or something does. And it's just a weird commentary on what we value as news these days as well, because it's been a period of doom and gloom, and there are still major challenges. Obviously, Eleanor Slater is a huge one. Housing in general is a massive issue right now. And the relationship between the ARPA, the American Rescue Plan Act dollars, in terms of the McKee administration strategy, and then the Rhode Island Foundation's suggested strategy. Of course, you were there, one of the few reporters that were there covering that rollout at the Rhode Island Foundation. Those are stories that are more about tension, but there are good things that we've learned as Rhode Islanders. I guess pivoting now, though, to those ARPA dollars, you were there at that press conference that the Rhode Island Foundation rolled out their projected or imagined use. Most of it goes to housing. That's not the McKee administration's plan as of right now. What do we need to do to adequately spend that money?
That's a great question, Bill. First of all, I think we need to understand that the $1 billion is just the beginning. It's a start. And we need to make a series of strategic long-term investments that will require a more dedicated flow of revenue coming into the state from taxes, and I'll say that word, to make it happen. we are way behind when it comes to housing. I did an interview with Brenda Clement, who's responsible for the housing facts, the housing fact book. And as she pointed out, we are way, way, way behind. That we are, when it comes to investments per capita, Rhode Island's investment is the lowest in all of New England. And we're not going to catch up in 6 months or a year or even 2 years. It needs to be sustainable. It needs to be more than just a one-term shot in the arm. We're going to need a series of investments. And we also need to look at what do we mean by housing. So there are all sorts of interesting ways to look at that. If the model of housing is the single family home, we have problems because most people don't fit into the normal classic single family home dwelling that is a product of, shall we say, the aftermath of World War II.
Right.
And it does reflect the fact that most people live in, I don't want to say disrupted, but various forms of family that require some innovation around what we think about as housing. And the second part of that is to realize that what we have, the largest percentage of old people in Rhode Island, people who are 85 years and older. And what that means is that we have to think a lot about what it means when we create a neighborhood or a community. And so the two things that are not part of most housing projects, one is daycare for children and elder care for people who are older, or at least a community center where they can meet. And those needs are really critical. So you go to the current staffing shortage at hospitals and nursing homes, and you think, well, why not provide housing for the employees near the campuses where they're working as either a pilot program? I know that some insurance companies are building such housing out in Phoenix, Arizona, for instance, and also in Oakland. But what a great idea if you have these campuses as a condition, perhaps, of the proposed merger, that you actually create housing for employees where they can live. I could ramble on for a while.
Well, I guess that's the whole point here. But that's a great point, and it also feeds into the next area to get into, which is, look, this hospital merger that is. It's a beast. It's a beast, obviously, from a regulatory standpoint, from a PR standpoint. It's a beast. What the real question, though, that everyone really cares about and should care about is, how does it affect healthcare if this particular package goes through and the three entities collide? Is it good or bad for Rhode Islanders? And is it good or bad for the state as a place to attract talent and retain talent in not only healthcare in terms of working in the hospital, in the emergency room or an operating room or whatever it may be, but the areas that surround it in medical supply, in insurance, and frankly, even in parking lots and things like that? Is this good for Rhode Island? This episode is brought to you by Elmwood Songwriters Club, presented by B-Town. It's a monthly showcase featuring 7 artists from all around the region. With the order drawn at random, each artist performs 2 songs. You can find details about when the next event is here in Providence by following me on Twitter and Instagram at Bill Bartholomew.
I always hate, you're asking good questions, and to put things in a sort of a binary options,
Sure. Yep.
I once had a producer from Chronicle in Boston who was about to go up to Quebec and do a story about James Bay. And she got on the phone and asked me, James Bay, are you for it or against it? And I was laughing because here is sort of one of was then the biggest hydroelectric project in all of North America. And currently, more than 10% of all of our electricity in Rhode Island and New England comes from Quebec, from these huge, massive dams. And there's so many nuances to, are you for it or against it? I think you have to ask the question, what do you want to, at the end of the day, if the entities merge, what are the conditions that you want to place on it so that people's healthcare is protected? And where to begin? Healthcare is complex, it's personal, it's disruptive, and in many cases for people, it doesn't work. And it's hard to get the care you need. Should that care be delivered at hospitals? Hospitals should be something that's available, but you're really looking at, can you prevent medical costs from rising in the future? And how can you prevent illnesses? So, you look at a place like Women and Infants Hospital, which is one of the top hospitals in the region, which cares for women and children and particularly focuses on giving birth. They're really having a hard time financially, not because they're doing a bad job, but because they're doing a good job. They, about 80% of all Rhode Islanders give birth at Women and Infants, and it's considered to be a high quality institution. But the financial basis of that is hard to maintain. So they have a NICU, neonatal intensive care unit, and it's very expensive to run. But because they are involved in preventive programs to try and reduce the number of low weight births and early births and complicated births by educating parents and first-time moms, the population of the NICU has gone down. So it hurts them financially by doing a great job of prevention.
Yeah.
So you're limiting future long-term costs, but it's what's the value of having a great place to deliver a baby? And how much of that value should be reflected in not just higher rates, but investments by the state and by insurance companies in making sure that institution has the ability to do its good work. They have an amazing program for nurse midwives. They train all the residents at Brown University in obstetrics. And their program is recognized around the world, but few people know about it. And it's the quality of the program. But how do we measure that? How does that get played out in insurance rates? And what does that mean to make sure whatever happens going forward with a merger, that type of excellence is protected?
Yeah, that's the big question. I think that's what's on everyone's mind is, okay, do I have to go to Boston or New Haven to receive that level of care in the event that a merger takes place that, frankly, from a business standpoint, cuts a unit that isn't making money out?
Well, I don't think anybody's going to go to New Haven or Boston to have their baby delivered, number one.
Fair point.
Number two, that it's not where the competition is. And number three, if people are being asked about medical care, and I'll be honest, I've had some health issues and I'm being treated by a team of neurologists at Beth Israel in Boston. And it's not to denigrate anything that happens here in Rhode Island, but if I had the choice, and I did because my neurosurgeon was in Boston, and he made the recommendations of who to see in Boston, for me, it's a matter of life and death, and I'm going to trust the expertise in Boston, not because I don't like Rhode Island. I've lived in Rhode Island for more than 30 years. It has a great quality of life, but if I can get better care that will save my life, I'm going to go into Boston. And it shouldn't be a competition. It should be something that's welcome of the type of collaboration that can happen. And the idea that the world will fall apart and people will drop off the face of the earth when you leave the 401 area code just doesn't make sense.
Yeah, well, in general, I definitely agree with that statement as a whole, and your comments there make perfect sense in the context of medical care. Last area here, last couple of minutes. Obviously, 2022 is an election year. There are already 6 candidates in the Democratic field. There's kind of one Republican. There probably will be another one in short time. Besides, in some cases, posturing or believing in reforming healthcare, the business of it, what are the issues that you want to hear candidates talk about and raise to that level of debate stage, news conference? I say that in the context of 10 news conference interviews on major platforms that reach a lot of people. What should people be raising right now? Because we hear, whether it's Dr. Munoz or Matt Brown or Secretary Gorbea or Treasurer Magaziner, the governor himself, we hear a tremendous amount of conversation around the importance of healthcare. But what issues are they missing?
Well, it's what questions do you ask? So if all the candidates had to answer, how many health equity zones are there in Rhode Island?
Yeah.
Which communities do they serve? And why are they important? That would be my number one question, because 90% of what happens in terms of health outcomes occurs outside of a doctor's or a nurse's office or outside of a hospital. And finding the solutions to that really focuses on finding what's known as place-based solutions, working at the neighborhood or community level. And so the health equity zones in Rhode Island are a wonderful example of what you can do and move that to a new level. What investment is the state going to make in that type of innovation? The second question I would want is have them talk about the role that community health centers play. So, access, as we found through the pandemic, to a primary care provider is something that was assumed, but it's not a given. And so what you really want to is to improve access. And the folks on the front line are the community health centers. And so that we have to recognize the great work that they do. The answer gets complicated because it means you have to sort of understand how Medicaid works.
Yeah.
And, that's really hard. I can go off into Wonksville anytime to try and explain what's happening, but 3 important things are happening that people should pay attention to. One is the care of Medicaid members is being provided by what's known as managed care organizations, or MCOs. And currently there are 3 in the market: United Healthcare, Neighborhood Health Plan of Rhode Island, and Tufts. The government, under the McKee administration, is putting out a procurement to seek new vendors. So Molina Healthcare out of California and Blue Cross and Blue Shield of Rhode Island have responded to a request for information, and they, depending on what happens with the procurement, they may join in. But more is not better here, because you really want to understand who these private contractors are. And we need to have an audit, I think, of all the private companies that are doing this work. And to understand a little bit about things like the software run by Optum, which is used by both United Healthcare and Neighborhood Health Plan, which a study at Mass General found that it had racism embedded in the way it made decisions about what healthcare to deliver. One of those stories way below the radar screen. A third part of what people need to talk about, and I wrote about it in this week's edition, is the Senate commission that's examining the Rhode Island Executive Office of Health and Human Services, which was established 15 years ago in 2006. And nobody's really done a good analysis of, is it working? Has the consolidation worked? Or has it created a more entrenched bureaucracy that's very hard to overcome? And we're talking about half of the state of Rhode Island's budget. You know, the John Prine song, Sam Stone.
Oh, yeah.
Addie's Arm, where all the money goes.
That's right.
In Rhode Island, there's a hole in the government's arm where all the money goes to try and protect and I won't say rescue, but deal with an increasing number of people who are facing difficult times. And very often it can be daunting. We've heard all the horror stories about DCYF, which is one of the agencies. We've seen the problems at Buddha, the Rhode Island Department of Behavioral Health Care, Developmental Disabilities, and Hospitals. And Eleanor Slater is a really big problem. But it's only, once again, it's part of the larger agencies. We've seen what happened with UHIP. And too much of our dollars are not going into direct care or direct services. They're going to pay private consulting firms and business firms. And my belief is that the expertise, we already have that. We don't need to go outside and seek more expertise for policy. We really need to trust our own experts and bring them to the front. So any candidate who can seize on these issues and talk about them in a way that makes sense will attract a lot of voters. I think the other big part of looking at healthcare is women's healthcare and how that's related to things like daycare and childcare and parental leave and a woman's right to have control over her own body. Those will be huge issues in 2022. And I don't think there's no good polling on it. I'd love to see polling in Rhode Island that reflects what women want in terms of health care and whether or not there'll be a political force.
Richard Asinof, he is the founder and editor-in-chief and the reporter in the field, and he's the man behind Convergence Rhode Island. Be sure to check the website. New edition every week. There's a mailing list. It's one of the great assets in our media portfolio here in the state. And yeah, thanks so much for your time as always. Let's keep this going. If we can do some more, get into the weeds, as especially in election season. I think your analysis would be beneficial not only to the voting public, but probably the candidates who are listening right now.
Well, I hope so, Bill. Thank you for the opportunity to be heard. What I will say is that, I know I'm approaching my time limit here. I never knew. I wrote the story about the Senate Commission on, analyzing EOHHS.
Sure.
And you never know what the response is. I was really worried. It's really in the weeds. But the response I got was just overwhelming. People love the story. I don't get that type of response when I put on my wonk hat.
Yeah.
It's really important that people talk about this with each other so that it's not just you and me, but we talk about it and we share about it. And I don't necessarily just want people who agree with me. I'm happy to have an argument. I like to argue.
Yeah.
But we need to talk about this in a context of it's important. And one last thing, I republished this week an interview I did with Toni Morrison. And she's at the center of an electoral controversy in Virginia. And it's like, haven't people read her work? But what was marvelous about the interview, which I did back in 1976, maybe before you were born, Bill, I don't know.
Yeah.
Is how honest she was in talking about community and violence and divisions around race and women and sexuality. And it's a great interview. It's an antidote to misinformation. So hopefully people will share it widely. And once again, I know I'm going over time. And thank you. I appreciate any conversation I have with you is a great conversation.
Likewise, always a pleasure. Look forward to the next one.
Thank you, Bill.
Rhode Island's podcast of record, B-Town.
At HealthSource RI for Employers, we provide access to health insurance to more than 1,100 local businesses and nonprofits, and 96% of them renew through us every year. Maybe it's our choice of 19 different health plans, our 10 years of customizing solutions, or our one local team of dedicated experts helping employers find quality health insurance. See how our numbers stack up for you. Learn more at healthsourceri.com/employers.